Ebola in affected countries and beyond is palpable. A man in Guinea suspected of having the gruesome disease was left lying in a city street for hours. Passers-by too scared to help, medical resources stretched thin.
Let them come and take him from here, because we are afraid.
More than 930 people have died in the outbreak. The military now helping combat the spread of Ebola in Sierra Leone. Liberian soldiers are clamping down on travelers. No one with a fever allowed in or out of the country. And in Spain, health officials reassuring the public there is little risk of Ebola spreading from an infected priest evacuated from Liberia, now in isolation at a Madrid hospital.
He is stable with fever, and the most important thing is that Father Miguel is not hemorrhaging. This is a sign of a positive prognosis.
The World Health Organization will soon decide if the Ebola outbreak is an international public health emergency, which could initiate a more global response. The CDC is operating on its highest alert level, the first time since the 2009 swine flu pandemic. The agency's director briefed representatives on Capitol Hill.
We, with our partners, have been able to stop every Ebola outbreak to date, and I'm confident that if we do what works, we will stop this one also. But it won't be quick, and it won't be easy.
Dr.
The Ebola virus infection is systemic, meaning that it attacks every organ and tissue of the human body except the bones and skeletal muscles. Ebola HF is marked by blood clotting and hemorrhaging. Although it is not known exactly how the virus particles attack cells, it is postulated that one factor that allows them to do so is that they release proteins that dampen down the immune system response. The Ebola virus attacks connective tissue, multiplying rapidly in collagen. Collagen is the tissue that helps to keep the organs in place. The tissue is basically digested by this virus. The Ebola virus causes small blood clots to form in the bloodstream of the patient. The blood thickens and the blood flow slows down. Blood clots get stuck into blood vessels, forming red spots on the patient's skin. These grow in size as the disease progresses. Also, blood clots does not allow a proper blood supply to many organs such as the liver, brain, lungs, kidneys, intestines.
Outside the John F. Kennedy Hospital in Monrovia, Liberia. 20-year-old Ibaga Stiwo is sick. His parents wait beside him. All signs point to the late stages of Ebola, the deadly virus that's killed more than 2,300 across West Africa.
He just vomiting, he toiling, vomiting, toiling, he eat, he vomit. Don't let him get a paper back.
As sick as he is, he won't be allowed inside. The largest hospital in the nation, and many others just like it, are completely full.
But I want to tell you, any hospital now will go to the same month. They say we should wait, the doctor should come.
This is Ben C. Solomon in Monrovia, Liberia. This city of 1.5 million is the first major metropolitan area to face an Ebola outbreak since the virus was discovered in 1976. Hundreds have died here since the outbreak began in May, and the World Health Organization expects thousands of new cases in the coming weeks. With a limited number of hospital beds and personnel to treat the sick, many of the infected
The first symptoms of Ebola virus infection are a sudden increase in body temperature, strong headaches, and joint and muscle pain. Diarrhea, vomiting, and stomach pain usually follow, with internal and external bleeding in many cases. Bleeding can occur from the eyes, nose, and tongue. Unfortunately, there is no treatment or cure for this disease as of now. Survival rate is very low. Research is geared towards creating a vaccine. However, at present time there is no available vaccine for this virus.